Hi, everyone. Welcome to Mondays with Mel. My name is Melissa Chung-Mowat, and I am the NDP candidate running in the federal riding of Winnipeg North. Thanks so much for joining us for today's Monday chat. I'm really excited to have Christine Eisma joining us today. Christine grew up in Winnipeg North. She has strong and deep roots in the Maples community. And Christine is also a nurse. And we're just really thrilled to have you here, Christine.
Thanks so much for having me. I'm really excited.
Yeah, this is great, and this is the first time we're having a conversation, and so we were connected through a mutual friend, and so I'm just really so glad that you're here today.
Awesome.
So you know, Mondays with Mel is just very much about connecting with folks with connections in Winnipeg North to talk about, the realities that influence the lives of people living here. And, maybe if you don't mind sharing a bit about your connection to the riding and about your, your roots here in Winnipeg North and in the Maples, I'd love to hear more about that.
Yeah. So I grew up in the Maples, and so yeah, we're in the Winnipeg North, and I was born in Winnipeg. I'm a first generation Canadian, and as you know, the Winnipeg North is so diverse. So the multiculturalism is glowing, and it always has, and it continues to be. And I think that has really continued to impact me growing up around families that are like-minded and share the same lived experiences as my parents and my family. That had a really great impact on me, and it's still really, my parents still live there now, and it's really great to see that spirit continues to thrive.
Yeah, something that I share. So I didn't grow up in the riding, but I've been living in Winnipeg North and working in Winnipeg North for almost 10 years now. And yeah, that's one thing that definitely has made me feel so at home in this area of the city too, is just that diversity. And, for me, I'm a second generation Chinese Canadian. And, I think there's it's so diverse, and yet even perhaps with our generation, a bit of shared experience to growing up here, but having strong cultural roots with our parents and navigating that. And what does
Oh,
that mean?
totally. Yeah, that's totally, I hear you loud and clear. Yeah.
Yeah. And so, yeah, I think that one thing that's definitely something that's coming out so much. And so, yeah, it's just, yeah, it's always very cool to hear about people's experience here and how that is part of that experience in Winnipeg North too.
Yeah, it certainly lends to some camaraderie, no matter what your ethnicity or cultural background is, there is some camaraderie there, knowing that there is a shared experience, which is great.
Yes.
Yeah.
Yeah. And so last week or 2 weeks ago, it was Nurses Week.
Yes, that's right.
And, so I know that you're a nurse, and I'm just curious how long you've been working in the field, and what this last year has been like for you in this profession.
Oh man, I'm gonna date myself. I'm gonna age myself. So I've been nursing since 2008, in various roles. Currently, I work in an oncology setting. So a lot of our patients are immunocompromised, and when COVID hit last year, as it was for everybody, it kind of shook the feet from the world from under us. It has been a challenging year. My husband is also a nurse, and so we both, I feel that has compounded. Has compounded the stress levels for us in our home, but B, it also, again, with the camaraderie, we knew what each of us were going through in each of our work settings. Some of the best people I know are nurses, and I know that although 2020 and 2021 has brought on an extreme emotional and physical toll on all of us, I'm proud to say that I'm a nurse, and I'm proud to stand alongside the thousands of nurses that have, rose up to the calling this year.
Yeah, and I think it's just brought such a spotlight to the profession, to how much of our healthcare system is held up by the work of nurses and really so many other professions, but just that heavy burden too that's carried. Did it, what was Nurses Week like this year? Were there, I'm just curious as to how this week felt in comparison to perhaps other years past.
Certainly there was a lot to touch on because this year was so crazy, but I think a lot of the nurses, from how my conversations have been with colleagues or classmates, things like that, we get recognized during Nurses Week every year. It's been great. They support the public message is there. It's fantastic. But I think this year is different because I feel like nurses have or feel the most valued with the way the public acts outside of, how the public continues to progress with COVID. Like, I feel like I'm going to ramble a bit, but I think that nurses feel the most valued when citizens continue to act within the interest of public health in their mind. And then uniting and like working together to get through this pandemic is honestly the best way to show your appreciation for nurses this year.
Yeah, I think I've heard that echoed as well. And, just from some nurses that I know that it's when people embrace and understand kind of how their own actions, in ensuring that, we're social distancing and doing all the things that we need to do on our part, so that we can support people in these professions, and it's great to have that reminder that there's that direct link, right, between how we embrace and approach, this new way of life. For now, it's not always going to be like this, but that is truly a way to support people in the healthcare system.
It's just knowing, it's being mindful of the fact that your actions directly impacts not just nurses, but really everyone else in the society, right? And I think that's the utmost way to show that your value or your respect and value for nurses. That's all. Yeah.
Yeah. And definitely, something that perhaps, will hopefully come from this is just that renewed focus on how vital having a strong healthcare system is, and how important it is that we support people working, so nurses, to have not just that recognition, but have what they need so that they're working in a system that is functioning as best it can to keep people safe and healthy.
Exactly. It would just be to make sure that we are continuing to run like a well-oiled machine. And there's nothing like a pandemic will do that can highlight all these gaps in our care. And so, yeah, ensuring that those gaps are filled is another way to just to show and continue to protect the rest of the society for the future.
And and I think that like there's been a few things that have definitely been very much a big focus, especially in the first and second waves, around long-term care homes and the needs around supporting the elderly, and also supporting people who are working in long-term care homes. What are you seeing as some of the other areas that we need to focus on and pay more attention to?
Well, I did some research actually with long-term care homes during the second wave of COVID. And that really, and I also grew up a block away from the Maples personal care home. And it was such a tragedy that occurred there. And my heart goes out to everybody that was affected there. It's just, we need to continue to focus on safe care. That's really all it is. It's safe care that we need to continue to strive for, whether that be in staffing ratios, whether that be in use of restraints, whether that be, appropriate emergency protocols put in place, things like that. And then certainly I think the pandemic has also shown a light on the importance of primary care. And so one of the lenses that nursing focuses on is the world of primary care. Is this the idea that we can avoid a lot of our health issues if we started with wellness and holistic care, and start at that community level even.
Yeah.
And you know, that can greatly impact some of the end results that could have been prevented. I don't know if I don't want to sound like I'm making a big, I'm just saying that primary care is really important, and there is a lot that we can do to continue to focus our efforts in there as we move on.
Yeah, and like, time and again, like whether it's in healthcare or education or food security, it really, there's so much at the community level that we need to be able to empower communities um, to build healthy communities, right? And so
Yeah.
and understanding how that is all linked, and that if we have strong communities, that like that holistic approach that you're talking about, that down the line that impacts primary health, that impacts education, that impacts so many parts of you know the different functions within our communities and within our broader society. And so how do we bring that down to the community level, right?
Right, exactly. Yeah,
Yeah.
I think we forget that, and like I said, the pandemic has really shown light on that. The fact that it's so crucial to put
Yeah.
our efforts and to put our pennies into this piggy bank, because it can really have some lasting effects.
And I'm sure that uh, you're aware of all this work that's happening at the community level, but right now where we're at with vaccines, it's really amazing to see the different clinics that are popping up within like specific communities,
Yeah.
and the tactics that are being used. Tactics is a weird word, but like the resources and tools that they're using to connect with people who might not have the ability to get to a super site, or to have the information provided to them to understand what the vaccine is about. And so I don't know if are you able to touch on a bit about that work that's happening at the community to reach a broader group of people?
Unfortunately, I can't, I don't know specifics as to what they're doing to address. I do know, like you said, about the pop-up clinics. For people, sometimes transportation is a huge barrier to get to, or taking sick time from work, or leaving your children because you have no childcare. Like, those barriers are being addressed by having a lot of these pop-up sites come throughout the city. And I know within my current workplace, they are doing a lot of public messaging to get vaccinated, with our healthcare leaders within our organization. So they're putting out, little videos here and there about why they got vaccinated, why they feel it's important to be vaccinated. And, I'm all about knowledge dissemination. So in a way that we can understand it. So we have to, like you said, continue to address those barriers. I don't know exactly what else we're doing. I know not Norwood, sorry, Norwest Co-op has also just done something for that area there. But in terms of the specific work, I'm not quite sure. But yeah, I feel you're absolutely right on the head with, we need to continue to address the barriers to get through this.
And it is so, it is really impactful to have your neighbors, or, people you see as being community leaders, and other people kind of be able to get that information out and connect with others, to perhaps remove some of that fear and whatever that people might be having. And, I think there's been a lot of just discussion around vaccine hesitancy. But now that things are opening up, there seems to be hope that like thousands and thousands of appointments are being booked every day. And it seems like young people are just ready to, they want to get it done. And so I feel like there's this kind of balance between that I feel it's a shifting a bit. I would hope, I'm not sure, but
Mhm.
any thoughts around how, this is connected to combating that hesitancy and making people feel, that they can have open conversations about this?
Yeah, that's definitely one of the things you can start with is by having an open conversation. Getting the vaccine it is a personal choice, and we must respect that. But um, if people have chosen to not get the vaccine, I really implore everyone to, and even if you did, I implore everyone to really try to access as much information as you can about the vaccine, dig into the science a bit, gain a bit of a better understanding about the vaccine and how it works, why we need it, and what can occur, what the benefits are for the community as a whole. And it's a matter of just getting that information out there. So whether you have vaccinated, I encourage you to have a conversation with someone that is a little bit fearful about the vaccine, or if there's some hesitancy there, we can directly address it by opening up the conversation with our neighbor and
Yeah.
just asking why, and addressing closing that gap for them.
And I think this is so important, and so much of the work that we're doing is communicating in a way that calls people into conversations, right?
Mm.
Like it's so important, especially when there's so many things that can be so divisive right now in our community. It's like just having that opportunity to call people in, and that, like, yeah, not approaching it like in a way that it's like you must do this, but like let's have conversations, and let's bring people into the conversation um, that are part of the community too, because there's that level of trust, and that's such an important thing, especially in many of our communities, is like trust building, right?
That's exactly right. Yeah, I myself have gone and directly spoken to people that I know that have chosen not to get the vaccine, and I've asked, do you want to have a conversation about it? We can talk about it. I'm open to questions. I'm open to discussing it with you. Ultimately, it's still their choice. I'm here to talk. As a nurse, that's the approach that I hope to take, and I will
Yes.
continue to take.
Yeah, that's wonderful. Yeah, and Christine, thanks again so much for joining us for this conversation and giving us a little bit of insight into, your work, your connections in the community, your work with long-term care, and just having a bit of conversation about this vaccine rollout is really helpful. One way that we kind of wrap up our conversations is we ask a question to our guests. So for you, why is your community important to you? And how do we work together to build on its strengths?
So, from a healthcare perspective, like we've touched on previously in the conversation, is that healthcare is directly impacted by its community. So, as nurses, one of the most important lessons that in which one of the most important lenses that we view healthcare is with what I spoke about, is that primary healthcare lens. We can't forget that we can make such an impact on the health system as a whole when we start at the community level, partnering up with each other, people within the community, partnering up with other communities, political leaders, and your healthcare team can be so beneficial for the community as a whole. And I also think that knowledge dissemination and empowering the community to be their own health advocates and addressing those barriers to quality care will allow the community to be stronger as a whole.
Yeah, yeah, I so agree. And, just that what you said around empowering communities, and that because communities, and I go back to this often, that really communities know what they need to thrive, right? And it's about bringing all the different actors into that so that we can address things right in the community, we can support community right where they are, and there's just massive um, upside and positivity that comes out of that, and when we come with that approach.
I agree completely.
Yes. This has been wonderful, Christine. Thanks again so much for joining us. I look forward to staying connected, and thank you everyone for joining us today. We'll see you next week for Mondays with Mel. And yeah, have a wonderful rest of your day.
Thanks,
Thanks,
you too,
Christine.
Mel.
Bye.
Bye.